It is problematic to have this volume of days missed. We want to be able to work with parents and families and, to kind of talk to people about what needs to change and how we can work with them to change it.
Hello and welcome to the HSE Talking Health and Wellbeing podcast. My name is Noreen Turley, and today we're focusing on why every school day is a new day. Today we're going to be speaking with Áine O'Keefe, Director of Tusla Education Support Service, and Dr. Abigail Collins, National Clinical Lead, Child Health, Public Health, and the National Healthy Childhood Programme. Áine and Abby, thank you very much for joining me today.
Lovely to be here, thanks.
Great to be here.
Now, this topic of school attendance is kind of a tricky topic because we all have our own ideas of when our children should attend school or when they're able to attend school. And I know that you have this new campaign called Every School Day is a New Day. So can you tell us a little bit about the campaign and why really that we had to run a campaign like this?
Yes, absolutely, Noreen. I suppose post-COVID, what we're seeing, and Minister of the Day, Minister McEntee, called it out, we're seeing really alarming rates of absence in school. We know from our data that 1 in 5 children are missing a month or more of the school year, which is a huge amount of days missed. We know that among those children and young people, there are groups who've always experienced barriers to regular school attendance, but at that sort of volume, we know that there are new and emerging barriers. And I suppose we wanted to go out to talk to all parents, all aunties and grannies and uncles and shopkeepers and doctors and nurses and everyone in a child's life to say going to school every day is really important. Every day the school is open. If you can be in, be in. So the campaign really wants to say, look, maybe last week was tough and you missed a day or two, but you know what? This week aim for 5. Aim to be in every day because every school day is a new day. You can start again. You can improve, and that's really important, and we'll do it together.
Yeah. And Abby, from your point of view, do you have a rule of thumb? If a child has a cough or a cold, and are we just become more lax? Are we worried about sending children to school when they have a cough and we don't know whether we should or we shouldn't? Is there a rule of thumb that you have or you could share with us on that?
Yeah, I think it's been a really hard space for parents over recent years because we've had, I suppose, changing messages over COVID. Suddenly it was, stay back if you're concerned, if someone was unwell. We had a lot more of those stay home messages.
Yes.
And I suppose now we're trying to re-normalise. And for some families, that's tricky to do as parents. For some children, it's tricky when they remember times maybe when they were feeling fine and they didn't have to go to school to understand that was a different time, a different reason, a different sort of climate. So what we are trying to do is support families to consider when their child might be fine to go to school, when they should go to school and when they shouldn't go to school and when they need to seek help. So we have developed a new webpage which talks about when can I send my child to school or to childcare, and it's really to support parents with that. So the rule of thumb really is your child, if they are well, even though they have a cold or a bit of a runny nose, especially with younger children, especially into winter when that is really common, if they are well, then it's fine to send them to school. Make sure they understand the hygiene principles, really, really important. So the washing hands, the using tissue, coughing or sneezing into the corner of your elbow, really important messages to have. But if they are well, then send them into school. If they are unwell, they have a combination of symptoms. They have a temperature 38 degrees above, and you can tell that they are unwell. That's when you should keep your child at home. So that's when we say do stay off. But they don't need to be off until every last symptom has resolved. They need to be off until they feel substantially better. And I realise that's tricky. It's much easier to sort of say, 1, 2, 3 things, tick a box and no or yes. But it is about trusting that judgment as parents and using the information that we provide on the sort of mychild.ie pages to help support parents with that. Because absolutely going to school is really important for a child's educational development, but also their psychosocial development. So we know the importance of attending for school and preschool environments for children. The opportunity of friendships and play is really, really important. But it is trying to get that balance. And I think there have been different messages in the past. We need to acknowledge we've come through a difficult period with understanding those health messages. But yes, think about your child. Genuinely, do they seem well or not well? That's not to say symptoms and no symptoms. it's about getting that balance.
Yeah, and like you say, trust in your instinct. And Áine, part of this campaign then is to encourage parents to be involved in the campaign. Now, what can parents do to help children to know how important it is to attend school?
It's a great question, because actually for the service I run, and actually under the Constitution, it's parents who cause their children to attend school.
Yeah.
So it's very much that school setting out that sort of expectation really sits with the parent and sits with the family and community around the child. You know, what we've tried to show in our Every School Day is a New Day ad is it's about teaching and learning. You're in the classroom, but it's also about fun. It's about friendship. It's about that connection. It's about the, you know, sort of all the little interactions through the day. And it's about that feeling of connectedness. So I think for parents, the message is, you know, it's really important to go in regularly. It's really important to set the expectation. I absolutely know, I'm a mum of two. On these dark, cold days, you have to be incredibly organised. And even when you're not, you need to sort of make every effort to get out the door. And then if you need to go in and there isn't a tie or there isn't a jumper, you know, give the school a shout and say, look, they're missing this bit, but they're in.
Yeah.
And, you know, we'd be really working also with our colleagues, our school principals, our school leaders saying, you know, let's welcome everyone in. Isn't it great they're in? That's 101. So we want to say to parents, look, it can be difficult. We know figuring out, are they well enough to go in or they don't really want to go in? And you're looking at your child going, what's going on? Is there something I need to worry about? But, you know, talk to school early. Very often when we meet parents, they are really stuck in a difficult space with their child who doesn't want to go and they're not sure what's going on. The moment you see maybe a child not wanting to go, talk to school about how to support them better. If you're finding that maybe your transport arrangements for school or your pickup arrangements or something's really challenging, again, start with school, start early. I'm experiencing a barrier. I wonder how I could resolve this. And what's been fabulous about this campaign from my point of view is we're getting our message out to parents and grandparents and everybody who helps get a child to school. You know, you can do this, but also the partnerships in doing that. We have our gov.ie landing page now where you'll find all of the really great advice from my service, the Education Support Service, if you need particular help with getting a child a school place or getting in every day or resolving any barriers you're coming up against. And some families can have really particular barriers and we're there to help with those. But also to be able to have a landing page for our colleagues in Child Health, Public Health and HSE and Department of Health and the National Parents Council. It really is a collaborative effort post-COVID to going to school every day is really valuable and people may not be aware of this. Days missed here and there, they add up really quickly and they're more impactful than a block of time. So if you're sick for even a full week, if you were quite unwell and missed your 5 days, that is impactful. All days missed are impactful, but lots of random days that add up to 10, 15, 20, 25, they're really impactful. Believe it or not, they're more impactful. And, you know, I think we can imagine that sort of chop change. We all go Monday to Friday, put the effort in, get up, get to the end of the week. And, you know, when you break that, if for whatever reason you think, well, I won't make the effort on a Wednesday, it's much harder on Thursday, it's much harder on Friday. So it is creating the expectation and I think that sort of resolve. And not easy at all. Yeah, it is setting the expectation. It's looking for support. It's talking to your child about that expectation and saying, let's get in and, you know, let's talk to your teacher about what's going on that's difficult. And then it's also about talking to school to say, I know at one school we work around an intervention we've developed called Anseo. So, you know, we're all Anseo. We all want to be Anseo. We all want to be in. Post-COVID, one school had this lovely thing where they call each child in primary school by their first name 3 times in the first hour of every day. So a teacher finds a reason to use your first name a few times in that first hour. And that's really welcoming. It's really reaffirming, you know. In a post-primary school, we had a school that looked at some of the lates and then that turned into days missed. And they changed their start time because there was a good reason locally as to why there was a misfit with the start time of some primary schools. And they also, in rotation, have 2 teachers on the gate to welcome people. And those are some of the fabulous things that can happen. So you have parents making the effort and then schools doing what they're great at, which is welcoming children in. And I'm not saying that it's okay to be late, but you can deal with lateness later in the day maybe and actually welcome someone in, get them settled, get the day going. and then talk about maybe how we'll do better on the lateness the next day.
So you're constantly communicating with the schools to try and help them increase their attendance.
Absolutely.
Yeah.
And you're looking at what are the things that can be done. And what we're really doing is partnering with school principals and school leadership and looking at what is your pattern of attendance and how can we maybe think about small changes and also have maybe a month in the school year at the right time for your school where you really emphasise school attendance and you get parents involved and you get community involved and you get the children really importantly involved. And actually this week is a very exciting week for me because on Thursday, Friday, we're going to meet over 100 children and young people to hear their views on school attendance.
Okay.
And I think I'll be far wiser after this week than I am currently on that.
Yeah.
You know, we have had input from different groups of children, but this is a big consultation to say, what is it you're experiencing today in school? What do you think we need to know about how we can think about how you get to school every day more regularly? What is it you want to see more of? What can we help with?
So, Áine, very often parents don't even realise that their children have missed that number of days. And like you were saying earlier on, they might have 2 days here and 2 days there. And then all of a sudden it's 20 days or something. How can we help parents recognise that?
Again, another great question. I think what we often find, and parents tell us that, it's the school report at the very end of the year when they can't do anything about it, where you might get your total for the year. But actually, you know, parents will know they have an app on their phone maybe for their school. A very popular one for primary is Aladdin, but there's lots of different ones out there. And whichever one your school uses, you can actually go into that and check on your total attendance. And, you know, again, there can be very good reasons why you missed those days, but it can be helpful to sort of understand how many days here and there are going on.
Yeah.
So maybe it's to say to yourself, just every couple of weeks, I must check in and see, like I do with all the other messages from school and notifications, how am I getting on? And actually, if you're noticing those days build up, have a think about, is that me who's had something going on? Actually, is my child sort of saying they're not well often, or what's creating that sort of escalation in numbers? And talk to school about that. And we'd also be saying to schools and talking to school leadership about, be really helpful maybe to pop that number out to people periodically, to let people know this is sort of even at the end of a term or midway through a term, these are your days missed. And again, can't emphasise enough, sometimes days are missed, but what we want to really get across to people is every day your child can be in, they should be in. It's a precious thing, a right to an education. We know from all research that parents want the very best for their children.
Of course.
So I think it is that sort of post-COVID saying it was a point in time where decisions had to be made, but actually we're on the other side of that now, and education is really valuable and days missed are impactful.
Yeah.
And that might be tough to hear, but it's really important that we have a think about that and then talk to us if we can help at all. Talk to your schools, talk to whoever can help make that a little bit easier every day for you and your family. Because once they do get in, all of the benefits of being in are fantastic.
Yeah, that's really important. And Abby, sometimes it's not just the cough and cold that keeps kids away from school. And even if they have been out with that, it might be the first day of them going back into school. And you know, those anxieties, and we're constantly hearing more and more of young kids having anxiety at a very young age and being worried about going back into school, or just anxiety in general. What's the best way for parents to realise that it's a small anxiety or a big anxiety, or when to go for help for something like that?
Yeah, it's a real challenge. We feel like we've seen, and there's a lot more reports that that's a problem for parents, or a challenge for parents, and a challenge for our children. It's them who are feeling it. You know, there is a good amount that it's about that routine. And I suppose Áine was talking about the importance of the rhythm and the routine. And we know that with children with so many different things, if you get into the routine and you keep going, then it's actually can be better for them and better to plan and manage the kind of family around that, and work and all of the other competing pieces that are so prevalent in people's lives these days. It's busy if people are trying to work and they've got young families. There's so much going on, I suppose. So that rhythm and that routine is really important. And when that gets broken and you have to restart, particularly in a child who's maybe a little bit more reserved, a little bit more prone to be anxious, that's an extra hurdle to overcome each time. And so those sort of broken days that you talk about become really important in that context, because it's constantly asking that challenge to be made. Whereas if you just get into the routine and go, then you sort of classically have that at the start of term, and you have the conversations around that and explore that. And you'll know with your child, you'll have some sense of how much it's the thought of it, but actually they'll go in fine. And for some children, that anxiety might be a little bit more deep-seated, that it's going to be a much harder transition and that any change is more challenging. And you can see that in some of the behaviours. They might start waking more at night or think that they've got tummy pain and classic things that I suppose parents across the years have experienced, but it's how you manage that. And genuinely, there is something about once you get into the rhythm, keeping going, and it keeps exposing the child to they can do it. You know, like they do the day and they can feel good that they managed to do it. And they were with their friends, and most of the time, particularly with younger children, parents have a lot of experience of it when they're going to the childminders or they're going to the creche, childcare facility, or those early days in junior infants or senior infants where the child goes in and you feel awful, they were worried, and then you go away and you're worried about them, and then you speak to the parent or the childminder or the teacher or whoever later and say, sure, within 2 minutes of you're gone, they were absolutely fine and had a great day and all of that. So, you know, every child is different, and we've had these issues for a long time. We've got historical experience of that. But there is something that has challenged that a little bit more over COVID times. I think, you know, children have taken on a lot of those worries about what they saw and what they heard and their experience of health in a way that probably hasn't been understood or appreciated in the past. There hasn't been that same sort of exposure. So it's helping them to sort of reset that going to school is normal, that a cough and a cold is normal, and for us to understand that that is normal. And we have hygiene practices that are really important. We have vaccines to keep us well. And in terms of our mental health, it's important to be going to school to maximise those opportunities for wellness, for fun, for social engagement, and to feel that sense of achievement. And then when that is the norm of what you're trying to achieve, when there's deep-seated problems, then it becomes more evident, and that's when you need to go and get help and support. And, you know, your general practitioner is normally your first port of call to discuss these problems with from a health perspective. And they can signpost you to local support services or interventions. And obviously, if there is something of a higher calibre from a health perspective, then they can help support and manage that. But often, as Áine was saying, speaking earlier with schools, it's no harm to sort of say, Johnny is a little bit more anxious about the return to school this time. And I think schools can really help with that, really encourage that when they come in, not make a fuss. No child particularly wants to be singled out, I don't think.
Yeah.
But just that supportive nature for the first hour until they're well settled in each day, you know, just so they feel minded in that school environment. So lots of different challenges out there. It's not all about sickness and illness, and there's a lot for parents to manage. But hopefully on some of the information pieces we have on the mychild.ie, there's a variety of different things to support parents, information pieces. But the main thing is, you know your child, what do you think is likely to be the challenge for you? And how can we think ahead to that? So if that's a bit of an anxiety about return, planning that in, you know, maybe making the sort of preschool morning a little bit less chaotic. Often it can be later up, flying around, get this, get that, where some children need a little bit more space to manage that. Others, it's absolutely fine. For some, it's cough, colds, sore throats, sore tummies. The child might talk about that a lot. Is that a real kind of health thing? Is that a worry health thing? If it is a real health thing, is it enough to keep them off or not? So lots of different pointers and tips. Baseline premise is that children are much better off in school. It's where they should be to learn. It's where they learn so much, not just the reading and writing, the playing, the engaging, that helps them develop and really helps support them into that young person, early adulthood. And that's what we want to harness, you know. It takes a community to raise a child, as they say. So we need to look to that community, which a huge part of that is the school community. So use that support as a parent, and where you need specific health advice, the HSE.ie, mychild.ie has a lot of that for those really common childhood illnesses, infections, complaints, etc. And hopefully that'll support getting that balance.
I have a little bit of experience with one of my children who did have some anxiety. It was before COVID, actually, so we can't blame COVID. But just engaging with the school was so refreshing because they just knew the child and they're so open to communicating with you and they want to know these things. I don't know, Áine, I just found they were fabulous, and they have techniques that they could help my child figure out why she was feeling anxious or whatever, you know?
Yeah, and I think that's a great point, Noreen. I think one of the things, and it ties into what Abby's outlined for us there as well, you see patterns start to emerge. And actually what we often see in the attendance data is arriving late, going early, lots of partial days, then building to days missed here and there. And for any parent where you're, as you said, is it a tummy complaint or is it sort of a tummy complaint because of something else? And don't sit with that yourself as a parent and just worry, talk to the school.
But sometimes it is hard for parents.
They
feel like they're not doing the parenting right if they have to admit that their child is a little bit anxious or they have a pain in their tummy. Sometimes it's really hard to make that first step to the school, as if you're admitting failure or something.
Oh, I know. And we're all just doing our best.
Yeah.
And I mean, if we could all say that to each other, we're all doing our best. And I can't emphasize enough, everything that we see in terms of research, parents want their children to do really, really well. And actually, parents report that they know that their child should go to school every day. And it's just that sort of slight gap at the moment.
What is it that's making them say, oh, yeah, okay, I'll pick you up earlier. Don't bother going in today, or why are they allowing themselves to do that?
I know, and I think what we're starting to see emerge in the literature is post-COVID, after school closures, that there's that little break in the social contract. Schools closed, we all worked our way through it. But I suppose what we're needing to emphasise now is that was a point in time for a very particular reason, and actually going in every day is really, really important. And, it is not a failure to experience, a child saying, oh, I really want to get out of this. I'm not happy here. And actually, there'll be very individual reasons, many different things going on, some of which can be resolved relatively quickly, some that may indicate, other problems that need to be looked into. But it's never a failure. The school will want to have that conversation.
Yeah.
And what I know from the attendance data side is allowing that to build and for a child to become more and more irregular in their attendance and disengaged, particularly in primary school. It becomes really, really challenging at secondary school to return a child who's out and who's missed a lot of school. So it's often a pattern that starts small and early. And actually, as soon as you think, there's something going on here and I'm picking up a lot early and I'm dropping in late and I'm negotiating every minute of attendance, raise that hand and look for help, because the help is there. And look, there is no silver bullet. We all know we formed as a habit in COVID. Children form habits, and it's the breaking of that habit and the reforming of a new habit that's really, really, really difficult. And that's why I think the message of our campaign, every school day is a new day. I hope there's a sense of sort of forgiveness for all of us in that.
Yeah.
It's like anything you try and change. Oh, I had the resolve yesterday. It didn't work out for me today, but tomorrow's a new day.
Yeah.
And I will try again. And I think that's really important. I'm not coming out with a big stick and saying, we have a problem and actually maybe we didn't know we had the problem. We learned something really interesting in building this campaign. Parents thought that poor school attendance was someone else's issue. That was about other people. But when it's 1 in 5 children, that's about everyone's children. That's a big, big number. I would hope on the back of the messages today and our campaign, the parents have a think about what's going on in my house for my family, what's going on in my neighbourhood and my school, and are there some tweaks I need to make? Is there some help I need to get? Is there something going on that I'll make a bit of a change to? And if we all do that, then hopefully we will find ourselves in a slightly new habit with a new resolve that says, actually, no, we're going to go in today and tomorrow. And when we get to the midterm break, we'll all lie down and take a rest.
Yeah.
Yeah.
So, Abby, in a child's life, we know we have children with chronic diseases and they are going to miss a lot of school. So how do we deal with those kind of things?
It depends a little bit on your child, what the chronic condition is, and I suppose what the medical advice is around that. But I think that's a case where it's really important to have the close engagement with the school so they can kind of understand and that you can understand as well. So again, your default position can be to support the child to be in the school setting as much as possible, and the school can help enable you with that. So, sometimes it's around people who might have asthma, for example, that might classically get a lot worse in the kind of winter time. So making sure that you understand and accept that there are going to be times when that flares up and that's going to require particular care and attention, might need some medical treatment or some time at home, etc., might need routine hospitalization for something. There's going to be periods of health that mean you are going to be away from your normal routine. But then the rest of the time, I suppose the expectation is that they would be able to fulfill their normal lives and they'll be at school, and schools can help enable that. So knowing, what I suppose helps your child, if in terms of supporting them with medication throughout the day so they feel comfortable or you feel comfortable with them there, that might be part of it. Or knowing that, certain triggers for them might be avoided, or they might be able to find an alternative time for something, like physical education might be challenging for a child who's got bad asthma, for example. If you have those conversations with the school, then you can make a plan around it, which doesn't mean we have to say, miss the day where the PE is on that day, for example, I suppose. So part of it is going to be knowing what the sort of parameters are for your child in terms of whatever the condition is, which will be informed by your experience with them and be informed by your doctors and nurses in your clinical team, what they say, but can be helped and enhanced by those discussions with the school.
Yeah.
So I think that's really important. Sometimes with, children with chronic conditions, actually, they might be okay to attend school a vast amount of time, but actually they have lots of appointments and that can then take time away from school. So I suppose trying as best as possible to manage that if possible. And if you get to know teams and you have routine things, sort of say, they're in school, any chance it can be at the beginning of the day or at the end of the day, so you can go on to school afterwards or pick up from school and go on to the appointment. It is a difficult space to manage. Getting appointments is very hard. I perfectly appreciate that. And you have to take them when they come. But it doesn't mean the whole day needs to be lost often for that. So a lot of people, if they realise and are thinking about that, they might be able to swap appointments, change things, plan things a bit differently to help you in your routine. A lot of parents work as well, so it's challenging all the way around. So parenting is hard. I think we just have to sort of accept that it is, and we need to allow people to help us more. And those wraparound family supports that, we might have had historically aren't always there for people. Often we're living further away from grandparents and, supporting family networks, which makes everything that little bit harder. So if you've got a child with a chronic disease, think about how you can manage that best for yourself, for them, how others can support you in terms of clinical appointments and supports and information. And from the school perspective, think about what are likely to be the flare-ups that are going to cause you problems and how might you manage and prepare for them. If you do need to genuinely be at home and the child needs to be at home and you need to be at home with them, how can that be done so it's least stressful for you and least stressful for the child too, because children pick up on all of our stresses. So I think there is something about trying to sit down and think about where, you are in the context of your life with your child, with whatever the issue might be, and plan as best you can around it. And that is really challenging for all parents, let alone parents where there are extra, I suppose, issues to kind of consider on top of that.
Yeah. Then, Abby, when you're talking about planning, I'm thinking about the inevitable days that we're going to have, the sick days. How can parents plan for those? One of the things I remember when my children were small, for example, you'd always have the Calpol in the cupboard. And then all of a sudden at 12 or 13, you've no Calpol because they haven't been sick for a while. And then you've nothing. So I'm sure there's loads of tips that you have how you can plan for those days.
Yeah, we would always say in public health, prevention is better than cure. So make sure you're up to date with all your vaccines, make sure your children are up to date with all the vaccines, and you prevent as much as you can in terms of the likely things. So the coughs, colds, sore throats that come around every winter, let's try and sort of minimise them. And the way to do that is have your flu vaccine, for example, and available for all children, which is fabulous. And I suppose the hygiene measures. So no environment is a sterile environment in that sense. Anywhere that you're living, going about your daily life isn't sterile. And a lot of things are infectious before people have symptoms. So that's why having that hygiene the whole time is really important, So practicing those good hygiene measures. But you're absolutely right, particularly the younger the child is and the newer they are to those sort of group environments, the more they're going to pick up infections. And that's really common. We expect that in young children, and it gets better as the child gets older, but doesn't go away. And as you say, it can be nearly more of a surprise then when you've got an older child. But it is about thinking about, are they well enough to go in with what they've got? And we don't want people to be dosed up with medicines to fire them into schools. That's not what we want either. They'll make other children sick, teachers sick, and they won't be able to learn. Knowing genuinely when they're not well enough to go in, that's when they should be at home for a few days until they are substantially better, and then they can go to school. And then the piece comes like, how do you manage that? And that is going to be different for every family. I suppose there's no one size fits all for that. Some children are older and able to mind themselves a little bit better, so you might be able to work from home on those days. Some families have, nearby neighbours or family friends or grandparents who can support for time while a child needs to be off. That really is about thinking of your network and the roles that you have. So the only real tip, the younger your child is, the more likely it is to happen. So what you're going to do when it happens, I suppose. You know, how do we manage that is really the important thing.
To add to that, in terms of the planning, I think what can be really important, as Abby said, when you're ill and you need that time to recover. But as a parent, what you can be doing in the background is maybe at primary school, scheduling a call with the classroom teacher, at post-primary school, talking to their year head, and just finding out what was covered while they were out, just finding out was there a particular activity, getting up to speed on what's been going on, what bits and bobs were covered in subjects. And actually that can really help, I think, with then the re-entry when they're feeling well enough, you know, in that day or so, when they're sort of nearly better, to begin to talk about the few bits that were covered and that you've had a chat with their teacher and that they'll be happy to re-explain long division or, you know, whichever little bit that was maybe missed. Because I think what we experience with children and young people is part of the apprehension can be, well, I missed out on something and I'll be lost for the rest of the week. And it's all those small things that you can do as a parent that aren't really small. They take effort, they take planning, but it's all about just going that step ahead of your child to think what else might they need to go back in the next day a bit more seamlessly, you know.
Yeah, that's really good advice. And Abby, you know, we always talk about vaccinations, and I think this is an opportunity to mention the vaccinations. What advice do you have for parents in general about vaccinations? Because it's just an ongoing public health issue to make sure our kids are vaccinated.
Yeah, it absolutely is. And we are so lucky to have the vaccination programs that we do. There are so many children in other countries who don't have the same sort of easy opportunity and access to vaccinations. And you see that in high numbers of cases of measles and complications for children, etc. So most parents will know that the big block of vaccines, I suppose, comes when they're young children. They have 5 sessions up until they're 13 months old. So really important that they have all of those. That's the real building blocks of protection for them. So absolutely recommend following those schedules. And if you've missed out on them at all, there is no shame. Go to your GP and say, do you know what? I didn't for whatever reason, but I really want to catch my child up on those vaccinations. And they can talk about what they need to catch up on and how that can be managed and done. It's never too late, but if you haven't had them, they're not protected from those infections. And they're all have severe consequences of them, which is why there's vaccination programs for them. So absolutely reiterate and reinforce the importance of that and getting good information to help you and having a conversation with your public health nurse or your practice nurse at the GP surgery, etc., to support that. School is also a place for vaccinations, which is great. You know, healthcare happens in schools as well. We have the school health program. Children in schools get their eyes tested, hearing screening done, and they have some vaccinations offered to them in junior infants and then again in secondary school when they go in. So school itself is a place where it's easy for your child to access some of the healthcare and prevention pieces that are beneficial to them. So I would say look out for those in school bags. Often it's sort of, you know, an envelope at the bottom of a school bag, which might have been creased and covered and folded in half a good few times. But get that information out, have a good read of it, hopefully sign the consent forms, get that back into school and know when those healthcare interventions are going to take place, because it's much easier to get them done when they're all being done in that kind of school setting. Or if you think there's a particular issue around that for your child, put the hand up. There's always a contact number. There's always a contact. Speak to the public health nurse or school nurse, whoever is going in there, and just say, I'm worried about this in the context of that for my child. And they'll have a conversation with you, either reassure you or find a different solution. So part of it is just, as Áine said, we want to do the best, being open about what is a challenge for you, me, our children, our family, our setup. And that's unique to us all, but there are supports available for that.
Yeah, that's what's coming through in this conversation is we're all working towards the same goal. Like you mentioned parents earlier on, teachers, public health, Tusla, everybody's working towards the best thing for our children. And it's interesting because when the campaign is every school day is a new day, and when I watched some of the videos, the excitement and the fun that the kids were having in school. So it's not just all about the books and the study. It's about those interactions, that communication, the socialisation. Isn't it really? It's not just about Irish and English and maths.
Oh, look, absolutely it is. Absolutely, it's not all about Irish and maths, but it is in part. You know, the teaching and learning is a big part of the day, but as big a part of the day really, I think, is being with friends, having fun, interacting with your teacher, interacting with everyone around the school. In the TV ad and the video on demand ad, you see that sort of energy and excitement through the school day. That looks like a pretty much a 9 out of 10, 10 out of 10 day. And that's what we want most days. And our primary school teachers are fabulous, and, school leadership is really great, and it's a lovely place to be. But, sometimes, and actually very often, most days are sort of a 6 or 7. Some days are a 3 or 4. And, that's the reality of it as well. But it's the being in every day and having that camaraderie and making friends. And actually, I particularly love our radio ad had a post-primary boy, and he was all, sort of did a little bit on, if I'm asked how was school today, I'll go, oh. We've all heard that response, but actually quiet in his mind, he tells us what he's really thinking, which is, I had lunch with the lads, that was great. I really enjoyed going to my rehearsal for the school play, and actually hanging out in lunchtime was brilliant. And I think sometimes we forget for post-primary, that socialisation piece, that togetherness. And I know a wonderful school principal of a big post-primary school said to me, the biggest message you could give to a secondary school student is bring your friend to school. Because really, very often at that age it is, it might be one friend, or it might be your 5 friends, or whatever way that works. But often when their friend isn't in, it's a little bit harder. So what we want to make sure is that we also recognise the importance of that connection for post-primary students, and that we're really encouraging that sort of going in together. And this year I have a new to post-primary myself, and I know for her a big thing is, I'm meeting so-and-so at this time and we walk together. And that's their routine. And again, it's back to, that's the certainty, that's the routine. And that really helps scaffold the day, So teaching and learning, absolutely. But isn't success moving on to the next thing, happy and connected and ready for it? And how we all feel successful or not after that is individual.
Yeah. I love the idea of that, bring your friend to school. I can see a campaign in that one.
Yeah,
I really can.
Phase 2.
Friends are so important. And our children influence their friends and our friends influence them. And it's just that connection that is magic. And I have to say, the way I see my own children coming home from school and what they say about school is rather different than even though I did enjoy school. But the teachers now are so engaged. They know the children. They're just amazing. For the most part, you would hope that it's a 6 or 7 or a 7 or 8, And then the 10, we'll aim for the 10 days.
We'll absolutely aim for the 10.
Aim for the 10s, yeah. So we're coming to the end of the podcast now. So from your point of view on public health and all those really important messages, is there any other messages that you would like to give to parents out there?
I think the main thing is you're doing a fabulous job, and it's not said enough. And it's not said enough how challenging it is being a parent in the modern world. I think really sometimes, I suppose, advice can seem like a list of jobs that have to be done rather than the kind of wraparound supports that is the aim and the hope for it. So, really what I would say is just remind yourself what a great job you're doing, and the reason why we're doing it, why we're being the parent on the tough days and recommending, come on, let's get going into school, or let's get going and have the social engagement that you're supposed to. And it's to have that happy, healthy, connected kind of child, which we all want. And no one has every day of the year. Let's not sort of put it in that sort of unrealistic kind of expectation, because there's up days and down days, and that goes for everything. So it is, every day is a new school day, I suppose, but every day is a new day in and of itself. And every family is going to have challenging times and challenging days. And hopefully, as a society, we're all more sympathetic and empathetic to that. And we look for the kind of supports that are available to us. And I suppose in this context, we know from a health perspective the importance of schooling and social engagement for future kind of health and well-being, which is, why I suppose as a child health programme, we're supporting parents with how to know when, from a health point of view, it's okay to go to school, and when to get help, when children should be off, and when they should look to get supports from GPs or public health nurses or schools themselves. It is important. But that said, it's not something that you have to do all by yourself.
Yeah.
Everybody has different challenges, and that's okay. But hopefully there's information out there to support and guide you with what can help you in your family setup, or who you need to get to help you.
And Áine, so you have this campaign. What would you like to see happening because of this campaign? How long is it going to be running for?
Yeah, so the campaign, I suppose, kicked off in September and ran right through to midterm break in terms of the different forms of media. We are hoping to come back out again just to remind people of the importance and to remind people of the supports that are out there. My hope is that we have a phase 2 and a phase 3, and that again we're As I said, we're meeting with children and young people this week. I think they'll help us shape the message. We're going to learn an awful lot from them of things we've probably missed. We are engaging with parents in the new year. And again, I'd hope that ahead of the school year next September, that we'll be coming back with more refined messaging, and that we are continuing to build our engagement at school level, supporting schools, supporting families, supporting communities to think about emphasising the importance of school attendance. So what I've learned over the last few months is maybe people didn't realise the extent of the problem. So we really want to emphasise it is problematic to have this volume of days missed. We want to be able to work with parents and families through the gov.ie/school attendance and direct contact with our service, and, to kind of talk to people about what needs to change and how we can work with them to change it. And to absolutely say, as Abby has said, parenting is really hard. And there are many, many challenges to think about, but maybe to make that first brave move. I always think the first step is the really brave one, and then good things come after that. To ask for the help, get the support. And for me, if our campaign causes every parent out there and some grannies and granddads and uncles and aunts and whoever else help get everyone to school, just think about how many days have we missed. Are there times where we're choosing to do things that wouldn't have been common in the past, like take a day off for a birthday or take a day off for an event? But that wouldn't have been the norm. And we do need to get back to a place where the celebrations are for the days when school is closed in that sense, or for the evening. Bring back our resolve around the importance of school. We know, parents know it's really important. And now we all sort of need to commit to that and just change our habit a little bit. That'll be my great hope for this.
Oh, thank you very much. And thank you both, Áine and Abby, for joining us today in our podcast. And hopefully that has helped some parents out there. And if you're looking for more advice on school attendance or healthy routines, managing your child's health, visit mychild.ie. And then, Áine, you said there's more information on
gov.ie/school attendance.
Okay, that's great. So for practical guides and trusted resources and sources of information, please go to both of those websites. And if you have any questions for us at HSE Talking Health and Wellbeing, please contact us on healthandwellbeing.communications@hse.ie. Thank you for listening.